Good morning. It's 1, 2, 3, 4, 5 days to the general election next week on Tuesday. This is KBC News Check and welcome. Of course, this is a program that we endeavor to ensure that we keep you afloat on each and everything that is happening or shaping the news of the country. My name is Njue and Lucy Mwaura will be my colleague on the sign language interpretation. Well, 22.1 million Kenyans are expected to cast their ballot next week in 46,229 polling stations. Well, the four presidential candidates that will be at the ballot on Tuesday have expressed their wish to serve Kenyans in various capacities. And in their manifesto, health has been one of the key spotlight when it comes to trying to woo voters. Talk about Baba Care, talk about comprehensive insurance cover, talk about medical marijuana, talk about emphasis on non-communicable diseases. If you've noticed, is that the four items I've mentioned is one of the key, each is a key component in each of the four presidential candidates. Talk about medical marijuana. Professor George Wajakoya talking about legalization of medical marijuana, talking about more emphasis on non-communicable diseases. That is Agano presidential candidate Waihiga Mwaure. Talking about Baba Care is Azimio and Kenya Kwanza talking about stepping up their universal health coverage. That is basically what we'll be touching on and trying to see where we are currently and what this manifesto are talking about, because manifestos are just manifestos, they are promises, they are not quite enshrined in law. So we will be trying to put more emphasis on what exactly they are talking about when it comes to matters health. Welcome. And of course, each and every time that we are here on News Check, we endeavor to ensure we know what exactly is happening in other parts of the country or what is shaping news. Currently, we also have the Commonwealth Games. We will be crossing over there at about 11 for a live coverage of those games. Also, the four presidential candidates are still trying to woo voters, so we will be checking on the campaign trail. I have Deputy President is expected in Kirinyaga. We are also expecting a live feed a little bit later in the day by IEBC. Remember, since Monday, they are now offering each and every day, they are organizing a media briefing just on to ensure that all Kenyans and all stakeholders are at par for the general election. The latest being that you will not be able to vote if your name does not appear in the physical register. Of course, the physical register has been the topic of discussion, but IEBC, as we know, is that it has talked about ensuring that the physical register is there. It's pinned right now as we speak. So it's go to the polling station. It's your duty to check whether your name and details are as it should be, because they said next week, if you don't have the requisite document, that you will not be able to vote, actually clearing what we have been having as the physical register debate. Well, a lot we have to talk about, but let's put more emphasis on health. Joining me on set now is not a new face in the medical world, and is also not a new guest here. He is the chairman of the Kenya Union of Clinical Officers, KUCO, Peter Wachira. Bwana Chairman,
yes.
Karibu sana.
Thank
It's been a while, we haven't seen you.
Sure.
We almost had a daily interview when it comes to matters COVID, but it seems that now the cases have gone down a little bit weaker, but the challenges that we've witnessed over the years have not been sorted out. But first things first, before we go to what the four presidential candidates are promising Kenyans, perhaps we can look at the report that the Ministry of Health talked about. They are pushing for, it's something that had already started being amended in Parliament just before the Parliament broke for the election. The cases of suicide, and actually the young people, unfortunately, are the worst hit. What is the current situation in your view?
Yeah, thanks a lot for having me, and thanks also for prioritizing health and linking the health with our politics, because sometimes we fail to do that. And I think it's a good thing that one as a country we're actually talking about health. The other good thing is that we are realizing the issue of mental health is actually one of the biggest issues when it comes to socio-economic development in our country. We are facing very rough times. We are in a time when we have unprecedented levels of unemployment amongst the youth, drug abuse, which results from the same, and of course at the end is mental health issues. I think in Kenya we have criminalized suicide, and that was from a misunderstanding of mental health, where we think that somebody just wakes up one day and thinks it's convenient for me to end my life. It doesn't happen like that. For you to contemplate suicide, it is a mental health issue. It starts from the usual stress, progresses to depression, and by the time you are contemplating even having that suicide, you are going into psychotic issues. And so this is a patient, this is not a criminal. And I think what now the ministry is trying to do is to try and address this in a way that it puts it under the mental health conditions. And so we can be able to promote and prevent suicide and mental health issues so that we actually do not have to get to there. And I think it also talks about the whole healthcare system in Kenya. Because you know, we say that the government is actually supposed to assure Kenyans of their health. But truth be said, we do not assure Kenyans of their health. We assure them that when they fall sick, we will do our best to restore their health. And for you to be able to assure Kenyans or any citizenry of their health, then you must be able to offer and to prioritize promotive and preventive healthcare services so that they do not have to fall sick in the first place. That is now when you assure them of their health.
But the situation, Wachira, as it is, the penal code under section 226, attempted suicide is a misdemeanor, punishable by 2 years or a fine or both. But nobody has ever been convicted on the same. I can tell you for free because at the end of the day, I also cover the courts. And Parliament, actually the Senate, moved in to amend that law, but was told that there are also plans for the National Assembly to do so. Do you believe that we should do that? We should decriminalize attempted suicide? Because these people don't need to be behind bars. They need to be in a mental institution like Madari and other mental health medical facilities that we have in the country. Because at the end of the day, these are not criminals. They're just seeking for help.
I totally agree. And I think that is why I'm saying, I think we have seen the light. It was from a misunderstanding point of view that we criminalized suicide. Because suicide is a mental health issue. You are sick mentally. That is why you decide, I'm contemplating now, I want to, and you even plan how you are going to end your life. That is not a normal occurrence. And so I agree. And I want to thank the National Assembly and the Senate. And I think it's about time. It should have happened so many years ago. In the first place, it was not even supposed to be criminalized and to be something that is punishable by law. These people are supposed to be taken through mental rehabilitation so that then we can be able to save these people from most of the people in the society who actually are not able to handle their stresses. Yes.
And Wachira, let's now look at the party manifestos as we wait to see what will happen or what will come out of that. Looking at the Kenya Association of Private Hospitals said that they have looked at the 4 manifestos, but the 4 manifestos that were unveiled, but the 4 manifestos did not really address the key issues that are ailing the health, in Kenya.
Yes.
What is your take? I'm quite sure you have, even if not conclusively, you have had a take on all the 4 manifestos. But they say, the Kenya Association of Private Hospitals said, we have looked at it, but not yet, not yet. Your take?
Yeah, I think it's a matter of perspective. And I think some of us, especially those in the unions, have participated in some of them in one way or the other, probably not comprehensively. What I would like to say is that I think as a country, let us start from the positive side. We are going somewhere. We are seeing health at the center of the promise of the highest offices in the land. We are seeing an indication that there will be political goodwill, and we have seen this with the current government, that health is at the center. So one of the enablers of the most important enabler actually of socioeconomic development of any society is health, because we say health is wealth, and so you cannot be able to attain socioeconomic development without the same. If you look at the health economists' reports that they have done and the researches, you'll see that they say that when you assure people of their health, and you do that by employing health workers, they say that when you employ one health worker, then you create 3 jobs out there. And how do you do this? They say this is because that money that would have been used by this person to go and seek health, treat complications, treat cancer, some of which are very expensive, that money will be used in investment, and it's going to employ somebody else. So we are coming to that realization. So yes, there are things that I think the 4 manifestos that have actually missed when it comes to the issues that are actually facing the health sector. What is the biggest issue that leads to the perennial strikes and service interruptions in the health sector to date? And that issue is the ineffective and disharmonious management of human resources for health. You remember in 2013 when we were going on strike and we didn't want to be devolved without the structures to govern this devolution, we were asking the government that we are okay with devolution, but please, as you devolve us, can you tell us how we are going to be managed? Can you tell me if I wanted to move from Nakuru to Nairobi, will there be a framework? Up to date, we do not have. If I wanted to move from national government to a county or county to national government, there is no framework. So many people are suffering the mental health issues that we are talking about because you find the wife is employed in Tana River and the husband is in Kisii, and you cannot get cross-county transfers. You are told if you want to transfer, then you can resign from one and seek the job from the other county. And you know, some of these issues were very well defined previously, and these things were, there was some parity in how healthcare workers were being treated. Right now, you'll find that in county number 1, they promote their people every so often when they are supposed to be promoted. The other one has never promoted from the time they got into service. This one takes people to specialization, back to school for specialization. The other one totally declines. And so the end, you realize that this now impacts from the accessibility and the quality of healthcare, which we are then supposed to be selling to Kenyans under universal health coverage. Sorry, not selling, that is political. Providing to Kenyans. But I'm saying that deliberately because most of the time it's political for politicians.
Yes.
And so what I expected to see, I think I saw it halfway in the Kenya Kwanza manifesto. They were saying that there will be an honest mediator in terms of health service commission. But that is also dishonest, because when you're saying you'll be a mediator, yet you'll be the one who will be in the national government, the one that is supposed to give direction when it comes to healthcare, then you're saying that my hands are off, I'll not be able to play an active role, yet you are the person who is supposed to be at the center of providing these solutions. I think I've also seen in the manifestos, I've seen there are some good things from either sides, and I've also seen some bold provisions
of
ambitious.
Of ambitious.
Not of ambitious, I would say bold, because in the past I think most of them have shied away from. If you look at the Azimio, they are talking of an emergency fund. If you look at our constitution, I think Article 43, it provides that every Kenyan must be able to access the services, including the reproductive, the emergency services.
It's true.
In the Health Act, we have even criminalized that healthcare worker in that facility that refuses to offer emergency services to that Kenyan who requires, whether private or public.
But does that happen?
But then we did not provide how are we going to compensate them. And that is why some of them, they still decline. It's only that Kenyans are not able to further that case. So Azimio is providing now for a fund to be able to cater for that. And I must say that that is a very bold move. It is also going to be able to make the implementation of that chapter and now to be a bit practical. If you also look at the other side, you look at the NHIF, there is a deliberate plan that is going to provide enough money to ensure that we do not have out-of-pocket expenses for Kenyans if they are going to hospital, hoping that that is something that is going to be actualized. And let me give you an example, because sometimes, you know, when we discuss here, people may think that it's a political discussion. Just the other week, a week ago, I was looking for a HDU bed for my relative. I couldn't get one in Kenyatta. The one I got in KUTRH, I was told I have to pay 250,000 as a deposit before I can be able to admit my patient who requires HDU.
You are a union chairman.
And which is an emergency in the first place.
200,000?
250,000.
And you're the chairman of a union. What about an ordinary Kenyan?
200,000.
It's a public hospital.
Yes.
Okay, that brings us to what you've just said. Article 43 of the Constitution talks about universal health coverage for each and every Kenyan.
Yes.
Well, of course, we haven't seen that yet. And looking at how these politicians have decided to place it, they've said that there will be universal health care for all. But let's first of all learn from what we've heard.
Yes.
President Uhuru Kenyatta will go down in history as the president who actualized the devolution since the 2013, and being a universal healthcare as one of the key issues in the Constitution. But we haven't seen that happening. And more so, the politicians are still promising us of better healthcare coverage. Health has been devolved since the year 2013. We are almost 10 years.
Yes.
What are some of the challenges and lessons that we have to learn from what we have witnessed, and especially lessons that we learned because of the COVID-19 pandemic?
Yeah, thank you. And I think I want to start with where you started, about the current government. And I think Mugala muwe lakini haki yake mpe.
Yes.
I think we must, as a country, thank His Excellency, the President Uhuru Kenyatta. He has been very deliberate about improvement in healthcare, even where it's not his mandate, because it's the mandate of the counties. And if you look at him, because I've taken time to also analyze and do so objectively. In 2008, when he was a Minister of Finance, there was an economic stimulus program. And one of the things that he put in place was in health, was employment of healthcare workers per each constituency, improvement of a health center in each constituency, and even capacity building the community health workers. Come to 2013, 2015, there was the managed equipment services. For you remember, there was a lot of noise about it. And today, because I've been involved in the service that have looked at those equipments across the country, most of our level 5s and level 4s in the counties are dependent on those equipments. You remove those equipments,
that's it.
You don't have you don't have the health services in those facilities. Then you look at the Big Four agenda. Health became one of the pillars of socio-economic development, and he has gone even beyond to improve some of the facilities within the counties to higher levels, and even to be able to, by the way, the national government has employed more health workers than the counties have done since 2013.
And it's devolved.
And it's
almost 10
already
years devolved.
Yes. And so we must give it to the president that he has really tried. He shows passion and the love of humanity to be able to do that. Now, coming to where we need to go and analyzing the county governments. And as I said, the problem is lack of framework. Because we took health, we gave it to political entities who do not understand. You give a very technical sector to a political leadership, and then at some point when they are supposed to provide technical solutions, they provide political solutions. And that is why you have seen the problems have really prolonged. There has been a protracted discussion and challenges that have been in between us as the leadership of the human resources for health, and on the other side the county governments. So the reason as to why the counties cannot be able to move commensurately with the growing population and the growing demand for health services is because they have ceilings. Like most of the counties, if you look at the WHO standards on staffing, which requires that you have about 23 healthcare workers per 100,000, if you look at our norms and standards that were made in 2014, that indicated that like for clinic officers, we needed to have around 16,148 by 2018. And with our computation, by now we are supposed to have around 25,000 in public service. We're only having 7,000. If you look at the commitment that was made by the Kenyan government in 2013 in WHO Human Resources Conference in Brazil, signed by the CS Macharia, the CS of health then, and indicating they'll be able to employ 12,000 health workers every year until they'll be able to reach the WHO standards.
But that has not happened.
We have not been able to do that because the counties, if you look at the PFM Act, they have a ceiling, the 30-70. The 70 recurrent, the 30 for development. Most of the counties for recurrent only, because they're only given money to pay salaries and whatever else, and the development bit is very lean, they have surpassed the 70%. So they have issues, they know they're supposed to employ, they're supposed to develop healthcare, but they'll not be able to do that because they cannot be able to surpass that. And that is why we are offering a solution. Can we then have an institution, and for us we are calling it Health Service Commission. The governors do not want that name, but we are saying, can we come together in a task force or so, then we discuss what is the best suited body that will be able to manage healthcare workers together and will not have this ceiling, so that whenever there is need for employment, of which we know there is because there is a dire shortage, and we have seen the effects of that, then it can be able to do so. And that is why the national government is having to employ, because the counties have no capacity because of those laws that restrict them and the resources that are given that are not actually enough.
Okay, and I will pick your mind a little bit later in terms of the Health Commission, because at the end of the day, it's true that some county governors don't want to hear about a commission that entirely will look at the issues affecting health sector in the country. But looking at what COVID-19 exposed a lot about our health sector, it is wanting. How has the situation been? Because at the end of the day, all the 47 counties were given funds, and actually the COVID funds to build more capacity in terms of how their responses to the COVID-19 pandemic. You know, the COVID just came. It was nothing any country expected, but it really exposed our health sector. What lessons have we learned that we need to actualize in the next government that is coming in after next week?
Yeah, thank you. I think COVID was a good thing and a bad thing. It was a good thing because it exposed the neglect that we have had for the health sector for a very long time. And it's a good thing because it actually made the government realize that without ensuring you get it right with health, you can improve socioeconomic status of a nation for so many years, but once you are going to get a health challenge, it is going to bring you down to your knees. And that is what it did. And I think we can still see the effects. The other problem is that as a country, we don't learn. And I think that is something that we need to change going forward. One of the things that should actually be in these manifestos is a promise to Kenyans that we are now going to learn from the lessons. And why am I saying this? I actually was the team leader for the contingent that responded for Ebola outbreak in Sierra Leone, and my colleagues were also in Liberia.
Yes.
When we came back as a group, we actually sat and made a report. And that report was trying to advise the government on how they should be able to model the health sector so that in case we have a health challenge like Ebola,
yes,
we should actually be able to respond without the country having to suffer. That report was never actioned. It is still gaining dust somewhere. And I remember I faced one of the county secretaries, I will not say which county, with the same, trying to discuss. And you know the answer that I was given? I was told there is no Ebola in this country. So when now it came to that, because what we had proposed is that can you take these people who already have this experience, you then train them and keep them as an emergency response so that they can even be able to sensitize and train the others in case of an outbreak, and you can be able to respond on time. The other thing is that you should be able to ensure that you have enough capacity in terms of equipment and facilities like HDUs and ICUs so that you can be able to respond on the same, and especially enough staffing that is of the right capacity. So that wherever you need intensivist or any kind of specialist, then you have enough for that sector. We came to realize that we have very few healthcare workers who are specialized in, for example, ICU care. And these are things that we would have been actually able to learn from West Africa, because it was the same challenges. It is not that it was not detailed, it was detailed and shared, but we just refused to learn. Now the problem is, even now, what our expectation was, post-COVID, or as we are recovering because we are not post-COVID, is that realizing especially the staff shortages that we were having and how they impacted on our healthcare system and our response, we are expecting that from every budget going forward, we should see now the government actualize its own commitment by now annually employing additional healthcare workers. But we have not seen this in the budget. And I think going forward in the next government, this is one of the things that we really expect to see.
And still on that, since COVID, not only President Uhuru Kenyatta has opened, in Nairobi alone has opened over 20 hospitals. And there are so many hospitals that currently have been opened since COVID struck. But unfortunately, some people argue that it's good that we have so many hospitals, but unfortunately, we need to build capacities in these hospitals. We need to equip them the way they should be so that we may not face challenges in case of an outbreak of something else.
Yeah, you know, hospitals are just hospitals. It's brick and mortar. Hospitals are operationalized, and the care that you get is determined by a healthcare worker. And that is the problem that we have been having with the political system. And I'm not trying to say that it was not in good faith to build these facilities. And I think we must commend the President and the NMS being able to build this capacity in infrastructure. But then, you must also be able to employ healthcare workers commensurate with the facilities that you have so that they can operationalize. If you look at the MES project, the pitfalls, the other challenges that we're having with it is that you're having machinery, but you are not having the specialists to be able to utilize this. And so you have very expensive equipment, you have very expensive infrastructure and good looking. But then people cannot be able to access that service because you have not been able to match that with the requisite skill and expertise that is required to be able to operationalize, so that at the other end, then that patient is going to enjoy the service that you actually want to deliver to them.
All right. Indeed, you're watching KBC News Check, and today we are looking at the health agenda when it comes to politics. Remember, we're just 5 days shy of the general election, and a lot will be in store until then. But after that, of course, it's back to business. After next week, we'll be having a new president. And looking at the 4 presidential candidates, they have promised us so many things in their manifestos, and health has not been left out as well. But looking at the 4 manifestos, the health sector, they're talking about, we are not yet there. We have looked at the 4 manifestos, but we don't see something clear in regards to how we can address the health situation in the country. And now, of course, I'm joined by Peter Wachira, who is the Kenya Union of Clinical Officers Chairman. And now we are also joined in, karibu sana, by the Secretary General of the Kenya Medical Practitioners and Dentists Union, Davji Atela. Karibu sana.
Thank you, thank you.
And let me just throw you into the deep end. We were looking at the health challenges. Before we even look at the manifestos of the 4 presidential candidates, we are looking at the health situation in the country. Of course, I'm quite sure you've had a chance to look at the 4 manifestos, and the Kenya Association of Private Hospitals, they talked about, we have looked at the 4 manifestos, but you have not addressed any health issues that we want addressed. And the COVID-19 pandemic just showed us how exposed we are in terms of healthcare in the country. I want your take on the same.
Generally, if you look at the health manifesto and we look at the healthcare in general, there's still much that needs to be done in healthcare. And you see, one element that is known for health provision, just like any other services, there has to be investment in healthcare for people to access it. So the Constitution 2010 enshrined, as it's enshrined, it empowers the public. It gives them a right to high standard of healthcare, a right to access emergency services and quality healthcare regardless of the facilities. But then these rights cannot be realized if we do not have hospitals that are structured with the personnel, with the drugs, to ensure those service provision. If you look back before COVID, we've had a number of industrial actions in different parts of the country, done some by the Kenya Medical Practitioners and Dentists Union, our union, some by clinical officers, some by nurses. And these have spanned over a period. We were trying to get statistics of that, and there could be up to 100 strikes that have been seen in different parts of the country. And largely these strikes are occurring because there's delay in salaries for healthcare workers and for doctors because they were devolved into the counties. And as I speak to you now, there are more than 6 counties that have not paid May salaries for the healthcare workers and for the county workers. They have not paid June salaries, they have not paid July salaries. And so if these doctors and all these healthcare workers are expected to be in the hospital to serve, it becomes very difficult because themselves also the patient at that point. So that is something that has been seen. We've also had strikes whereby we've gone for over 100 days, and some that have gone for 50 days, some have gone for even 6 months. So in all these times when there's industrial disharmony, the person who suffers most is the patient, is the public, because they can't access the healthcare. They can't go to the public hospitals and get the services. And at the same time, the doctors who ought to offer these services are not able to offer because they go to these hospitals and their role is just to supervise deaths. And when we say that, it's because you go to the hospitals and there are no drugs to give these patients. There are no diagnostic machines. There are no equipment. So you can't actually operate in a situation whereby you don't have those paraphernalia that necessitate your service provision. That's why we say that the emergence of the pandemic, in one way or the other, it just showed the frustration of healthcare workers, and it showed how broken our healthcare system was. And I think that was a point that healthcare is necessary for not only those public who gets it, but even for the leaders who are entrusted to ensure that it works. So that's what we've seen over the years. And therefore we have hope that based on that, there needs to be a change in the way the leadership of this country are going to look into the healthcare. They must know that, we must actually know that for us to have a proper economy, for there to be growth in the economy, for investment to increase, we must look at healthcare differently and invest more in it. Yes.
Indeed. Thank you so much, Dr. And Wachira, it's a good thing that Doc has talked about some of the issues that have lacked in all the 4 manifestos that we've had. The workers themselves. it's not 1, 2, 3 press briefings that we've had with you guys in the last 2-3 years in regards to how health workers are being treated. We're talking about a basic thing as salaries.
Yes.
But nobody has outlined that we will not have this talk again, because let's have a talk that we do not have enough medicine, we do not have enough staff, but we will not have a discussion on the promotions, on the pay. Actually, pay is quite basic, but it's a big challenge, but no one has addressed those issues.
Yeah, and I agree. I agree that, and that is why I was saying our biggest problem is in ineffective management of the human resources for health. If you look at pay is something that is guided by law. By the end of the period, if it's 1 month, you're actually supposed to have paid the salary for that month. It's in law. But the biggest problem I'm seeing here, and what we were discussing earlier, is that when you give a technical sector to political leadership, then you're bound to get these challenges. Some of them, and we have had, like I think Meru is one of them, and I think they are going on strike. We have had that the money that was meant for salaries has been diverted and either paid contractors or done other things that would help somebody politically. And if we had a commission that now looks at these things technically, some of these things would never happen. Issues of promotions are also issues that are guided by policy. When does one need to be promoted? If you look at issues of specialization, these are issues that are also guided by policy, and they are not only guided to help that employee. They are also guided so that the end game is that you are going to have improvement in quality and accessibility so that you can be able to access this healthcare worker. If you then are going to advance your skills in specialization, you are going to improve the quality so that we have a progressive improvement of the accessibility and quality of healthcare towards Vision 2030. Because it was a very nice path that was created by His Excellency Mwai Kibaki, by giving us that vision, and that is where we are supposed to be working towards. But now, with the challenges under the county governments, we actually seem like we are marching in the same place, and sometimes we are turning back and marching towards where we were coming from. And there must be a very candid and a very bold and a very courageous discussion. And this should also be seen within the discussions in political spheres at the highest level. Because what we need is that political goodwill, so that we see that there are provisions for us to be able to discuss and provide bold measures to be able to address this. So that then we can be able to attain the universal health care that we are talking about. If you look at the manifestos, because we have been having universal health coverage, and you know coverage means as long as it reaches you, as long as you have the access, then we are okay. We have reached our objective. But when now we are coming to care, and I think we must also give it to Azimio. Azimio, they are saying now we are moving from coverage to care. From UHC, universal health coverage, to UHC, universal health care. When now it comes to care, you are looking at that health that Wanjiku or Ranyango can be able to access. What is the quality? Now we look at the quality, how can we improve the quality so that now we reach the highest attainable standards of health as envisioned in the Constitution. And to do that, you must then be able to provide, how are you going to ensure, number one, the staff that are there are motivated and comfortable. Number two, you are increasing the staffing levels so that you don't have the burnouts and fatigues, and then we are going to have mental health issues and suicides like we have seen in one of the doctors' residents here in KNH. You remember that case? Who committed suicide in Haka?
Yes.
You remember the other case of a mental health nurse? Actually, a mental health specialist who committed suicide, I think, was that in Moranga? Yeah. And all these issues are emanating from these problems that we are having with these county governments because of ineffective management of human resource. So unless we have a candid and bold conversation about these issues, The other great things that we are promising Kenyans, we will not be able to get them right. Because if you don't have staffing in healthcare, there is no healthcare without a healthcare worker.
Even if you build so many hospitals, as people have argued that we may build as many hospitals that we may, but unfortunately the capacity, the workers, the drugs, the equipment is quite low, and especially in counties. Wachira here talked about the national government in its assessment in the last 10 years have done more. The national government, despite health being devolved, the national government has done more than the counties have. And the counties are the ones that are mandated to handle health in counties.
You know, when you look at the spirit of devolution and the general thing that it came about was to increase access to services. And so you have healthcare that was devolved. Though it didn't come out very clearly in Schedule 4 how we had the levels of the facilities devolved and the level 6. And that's something that we keep on bringing up in the discussion, because if that clarity comes in, then there is a way that services will be managed. But coming to it, the major thing that devolution was to bring was that every person within the counties that you are able to get services and optimal services. But then we see political leaders or the governors and people in the counties, they instead went into what we call a white elephant project, where you build facilities. In every county you realize that very many hospitals are built, there are 4 or 5 that have been built in different parts. And this is because the wananchi will see that this governor or this leader has put us the hospital up. Let's put up the hospital. But then the aspect of service delivery in those hospitals become part of the question, because we do not categorize hospitals based on how beautiful it looks on the outside, but on the services that it's able to deliver. If an hospital is a level 1 or level 2 or level 3 or 4, 6, it depends on the services that it's able to deliver. And that actually has failed in many of the counties, because statistically, if you look at from let's say 15 to 2021, the number of healthcare workers that have been employed into those hospitals are very minimal. In fact, a county like Embu has employed only 10 doctors in the last 5 years. The highest number of counties that has employed more doctors in the last 5 years, I think, is Nakuru, with a number of 30. So that brings the aspect of their facility.
You're talking about since devolution?
Since in the last, let's say in the last 5 years.
In the last 5 years.
5 years, they have employed 30. And that's the highest among the counties. In fact,
it's still a small number.
It's very little, actually, very low.
Being the highest at 30.
The highest, yes.
Still a small number.
It's actually a very minimal number. When you look at the report of the Council of Governors that was given on 8th of July, where they say that they've employed 762 healthcare workers in the last 1 year. That means that the employment rate that they're having is like 5% of the numbers that graduate every year. There's a big shortage of healthcare workers in the facility or in the hospitals that makes it difficult to actually get services in those hospitals. But there are a big number of healthcare workers, that is the doctors, the nurses, the clinical staff, that graduate every year and remain unemployed. So we always say that there's what we call artificial excess of healthcare workers outside the hospitals, but in the hospitals there's a big shortage. So that is in existence, and that makes it very difficult to have service provision in those counties. So there's inequality that is seen also in different counties. The way each county handles healthcare worker has been seen to be very different, because some governors value healthcare. I will presume, and I think the governor of Nakuru, to some extent, in terms of the elements of the CBA 2017-2021, he has implemented a big chunk. And that is different with other counties. Look at the county like Laikipia and Kirinyaga, who would actually dismiss healthcare workers when they demand for their rights. So this has been seen across, and that's why most of the healthcare workers have been looking at it, that it's a time that we need a centralized body that handles the human resource for health. We may leave the infrastructures for the counties to actually continue constructing them, and then there's this centralized body that will ensure that these hospitals, after they're constructed, they are actually healthcare workers that serve in those hospitals. That then will ensure that there's service provision. But as we see, one thing that we've noted that is making healthcare not to work as it ought to be is the aspect of commercialization. We think that the commercialization of healthcare moves at a higher rate than the regulation of the same healthcare, such that the investors in healthcare are the same ones who have been entrusted to actually make healthcare work. We have the governors, we have the senators, we have the MPs. Some of them were in the health committees in the parliament, and Senate Health Committee are the same ones who are private owners of big hospitals. So in real sense, they'll make regulations that will mostly benefit the private hospitals. So you will go to the public hospital that has been built, but you will not get the services that you need. You will not get the doctor because you will take for so long and they've not been employed. You will go to the hospital, you will not get the lab services, you'll be referred outside. You'll go to the hospital, you'll not get the drugs, you'll be referred outside. So in essence, the system has been made such that the private hospitals will prosper better than the public, and in all that, the cost cannot go down, the affordability cannot be ensured. And even the manner in which the country is planning to run the UHC with the umbrella of the National Hospital Insurance Fund, if things are not made such that the NHIF funds more public than private, then we will be in the same way that it's going to benefit only the private owners of the facilities. And this is evidence in the current expenditure, where 80% of these funds go to the private hospitals. So then the public hospital remain without enough funds. So essentially, there's need to actually structure and see how are we going to invest in healthcare, and actually public healthcare, to ensure that there's service provision to all the citizens.
It's a good thing Doc has brought about the issue of the NHIF, and one of the actually it's Afya Bora Mashinani by Kenya Kwanza, talking about the reduction of the premiums, the NHIF premiums, to around 300, and they want to actualize the universal health coverage that, of course, we wouldn't really say it has really worked in the Jubilee government, but they still want to talk about reduction of some cost, and they also want to cover some of the non-communicable diseases. Do you think this will work under what the situation that we have in the country?
Yeah, I think what I saw in that proposal is rather complex. I'm also still trying to understand the whole bit of it. But what they're saying is that for common Wanjiko, you bring it down to 300. For those who are working, you give a certain percentage. I know there now we will have an issue also, because as unions we have to be also involved when you want to touch on the salary of the worker. Then there is also provision that is already in law for matching. Whatever the employee contributes, and then the employer matches that. And then they're also saying that now on top of that, they look for ways to be able to cover the difference of I think 150 billion, so that nobody has to do that out of pocket. So I don't know how they're going to actualize. It's very ambitious, I must say. If it's something they can actualize, then it would be very good. On the other side, on increment of the rates for NHIF, when we have seen people not able to access, even with the retro that they are contributing, even for employees, and getting services that are not satisfactory to them, where you go to this facility and you're told we no longer take NHIF because we have issues with them paying us, then how will these employees be willing to pay more to the same body which does not guarantee them these services? So I think it's something that really needs to be broken down so that people can be able to understand, and especially the working class, which is supposed to be targeted, and for them, for theirs to be increased, so that we can be able to understand this. But I think what they are getting right is that we really need a deliberate model to be able to fund our healthcare. Right now, you are only one disease away from poverty. As I was telling you earlier, we were looking for HDU services. KUTRH told us we had to deposit 250,000 before we could be admitted. We actually ended up going to a private facility, and we are having to pay an arm and a leg for us to be able to meet the bills there. And so, for many Kenyans, number one, you are not even able to access the intensive care or HDU services. And if you are going to access them, it doesn't matter whether in public or you are in private. In this context, it's going to impoverish you. And so we also needed, and I think that is also something that we also missed in the manifestos. And my thinking is that the government should actually be able to make ICU and HDU services free. Because nobody will fake a disease to take them to HDU or ICU. And many Kenyans are dying, not because they were supposed to die, but because they cannot be able to afford these services. And you can see even accessibility in public hospitals is also an issue. If a public hospital has to tell you to deposit 250,000 so that you can be able to access that service, not that they do not have a bed, but because you have to pay some money first for you to be able to access that.
Yes, and it's a very good issue and pertinent issue that he has brought about, because even Kenya Kwanza, they're talking about increasing the budget for health from 4% to 15%. It might seem as overambitious using what you said, but even some of the services that he's talking about, they're out of reach for Kenyans, despite you having the basic insurance and others like us in employment who have even a secondary cover. You have to the out of pocket. What about the common mwananchi? Hold the thought, Doc, but as at the moment, in case you just joined us, this is KBC News Tech. We are looking at the health agenda, just 5 days to the national pause. But now we are crossing over to Lanet, where the reason of today, the operationalization of the National Defense University, and we have our very own Beatrice Gatonyenge, who is on standby, as you can see on your screen, to give us the latest. BT, take it over.
Thank you very much, Ben Troy Njue. I'm coming to you live from Lanet, Nakuru County, where President Uhuru Kenyatta will be inaugurating National Defense University, Kenya, here today. The National Defense College acquired its university status last year in May, after President Uhuru Kenyatta awarded this institution a university charter. In March this year, the university admitted its inaugural students. A total of 446 students are undertaking their studies in this institution, and most of them are from Kenya, and also international students are also welcome to this university. This university brings together premier of colleges that are linked to the national security organs, and these university work together. These colleges, work together with the university, and they admit students from Kenya. So today, President Uhuru Kenyatta, in a short while, he will be arriving here to officially inaugurate this institution so that it can start its fully operations as a university. And Chief of Defense Forces has already arrived in this place. NMS Director Mohamed Badi has also arrived here, and they will be receiving President Uhuru Kenyatta, who will be arriving here so that this event can officially begin. It is a university that gives a specific education, mostly to the national security forces. And during the institution's 24th graduation ceremony, Chief of Defense Forces Robert Kiboshi said that elevating this institution into a university was going to enrich the force's human resource and also enrich the regional integration as a training center. So today, the university will officially be inaugurated by President Uhuru Kenyatta, and we'll be here to bring you up to speed on what will be taking place here. I take you back to the studio. Ben Troy.
Thank you. That has been Beatrice Gatonyenge live from Lanet. As you can see from the photos, from the video actually behind her, is that today is a big day because President Uhuru Kenyatta is expected to operationalize the National Defense University in Lanet, which is, as she has said, over 400. We'll be having at least over 100. It's a big milestone actually for the security forces, not only in Kenya, but in the region. Kenya being one of the countries that has made some strides in ensuring that not only do we have the best kind of defense system, but also education as well. Of course, we're getting back to that live coverage as soon as the head of state will be actually launching that university. We will be crossing over to Lanet. Thank you so much, BT, for that. Just in case you joined us, this is KBC News Check, and we are looking at the health agenda, and I have the professionals right here in studio. On my immediate left is Peter Washira, who is the chairman of KUCO, that is Kenya Union of Clinical Officers, and we have Dr. Dabji Atela, who is the Secretary General of the Kenya Medical Practitioners and Dentists Union. And before we crossed over to Lanet, Doc, you were talking about one of the proposals by Kenya Kwanza, talking about Afya Bora Mashinani, and the increasing from 4% to 15%. We have seen so many challenges. Perhaps that can be a way of alleviating some of the challenges we have in health. But again, is it even practical?
The idea of 15% budget, over the budget, 50% of the budget in the annual budget into healthcare is not far-fetched. It's as per the Abuja declaration that happened in April 2001.
Yes. In
Africa, we only have South Africa and Rwanda that have so far complied to that particular declaration, where the budget, the 15% of their total budget goes into healthcare. And to really have healthcare improved in this country or anywhere, there has to be an investment. Healthcare can never be free. You cannot get drugs for free. You cannot get doctor services for free. You cannot get any services of healthcare for free. Somebody has to pay. And if we want to have universal healthcare where there is accessibility of healthcare for all Kenyans regardless of the socioeconomic status, if you want to have access to specialist services, if you want to access to all the facilities and to the drugs, then somebody has to pay. The government has to invest in that healthcare, and not necessarily through the NHIF, as it said, because NHIF go and limit your access to the facility. Probably that will mainly cover the recurrent expenditures of the medications and other things. But if you want to have the right status of the hospitals with equipment, with the personnel, then that budgeting has to be there. The reason why we have been lagging behind in how we have been looking at healthcare is because in this country and many other developing countries, we have been seeing healthcare as an expenditure, but not as an investment. And we saw the WHO director really insisted that it is a time that we need to look at healthcare expenditure, healthcare investment as a pivotal for any growth in an economy. Because when we have an health economy where there's emergency services, where the drugs access is available, where the special services are available, then that economy can actually grow. So that's one thing that I will say about Kenya Kwanza. It's not far-fetched. And also to the Azimio, it's not far-fetched. But ideally, how practical are they going to implement it? That's the part that you have to look. I am not political, neither am I a political student, but in a way I have decided to ascribe to some of the manifesto promises of the Azimio government or Azimio or leader party, because I see the aspect of the promise in the sense that they have given a breakdown of what they want to do in 100 days. And you see, that's the practical aspect that we need for healthcare. We need that in this period of 3 months, what are the major things that are affecting the service provision? We know, and we have said it as earlier, that there's an extreme shortage of healthcare workers in this country. If we will have the annual recruitment of healthcare workers, the same way we have for police officers, the same way we have for the armed forces, then we can be very sure that there's going to be change. Because in 2012, the ratio of doctor to patient in this country was 1 to 17,000.
1 to 17,000.
17,000. The WHO recommendation is 1 to 1,000. In 2022 today, the ratio of a doctor to patient is 1 to 16,000, meaning there's not much change that's happened over these years. Yeah. And this is in total from the doctors that we have that have graduated from the universities. We now have more doctors actually leaving the country because the counties are not employing them. And those who are employed are on poor terms, that they do not see the need to stay in those particular hospitals. Like as I speak, there are 2 anesthesiologists who are working in Nakuru County who have left for UK. There are about 10 doctors, surgeons in the country who just left a month ago, also for opportunities abroad. And this is because of the packages that are getting those places. There's a value to offer the services. And therefore, that's for us to really see that the universal healthcare is achieved. We don't need to really focus on brick and mortar only, but we need to focus on the personnel that will be providing these services. We need to have interns graduating, and they don't need to stay for 1 year, the way we saw they did last time, where we have to demonstrate for them to be absorbed into the system. We need to have doctors, clinical officers, nurses after graduating, because there's demand for their services, that they get posted and they get employed to offer services to the wananchi. And this can only happen when they have budgeting done for the healthcare. We have real budgeting. This year, 2021-2022, 2022-2023 budget, the healthcare has only covered 4.4%. So in that regard, we can see that the issue of UHC is just a mirage, which cannot be achieved under that budgeting, unless that is changed. We have seen the previous year and the years before that there's nothing much that is being seen on that. We have a Ministry of Health that, according to the Constitution, is in charge of policy and the capacity building, or rather training. So when you look at what they've done over the years, we have some of the best policies in healthcare.
Yeah, actually, the issue has been implementation. It's not only in the health department, but we are going to still pick it on that. And of course, I'll give you, Wachira, an opportunity to weigh in on that, because we have seen doctors, we make them here, the doctors, in terms of services, in terms of education, but they seek greener pastures elsewhere, which is also detrimental to the health. But first of all, let's cross over to the coastal city of Mombasa. Just 5 days to the national election. Our reporter Michael Mwandiga is also weighing in on that, and especially on the preparations. IBC says we are set and ready. The security sector, led by CS Matiang'i, said we are also ready. Is Mombasa ready? Michael?
Well, a very good morning to you, Ben Troy. Of course, you're coming to you live from Mombasa County, and it's only 5 days to go before the D-Day of the general elections, the 9th August polls, and the preparations are on top gear. Speaking of which, currently there's a meeting underway consisting of all the security agencies in Mombasa County, and also including other private security personnel, and also religious leaders who have just converged here at regional headquarters just to plan ahead on what means or measures are to be put in place regarding these general elections. And currently the meeting is underway, and after the meeting is over, they will brief us on what they have planned or any other grey areas which they have, of course, get into details to know what security arrangements to do. And speaking of which, as of yesterday, several security personnel have been deployed in Mombasa County in different areas just to ensure that these elections will be or there'll be law and order being enforced during the elections. And just 2 days ago, the regional commissioner Edward John Elungata, I beg your pardon, assured coast areas that all systems go, everything is in place, and there's nothing to worry. Just telling them, come the 9th August, everyone should practice his or her constitutional right without any fear. But also urging that the electorates, immediately after casting their votes, they should leave the polling centers and go back to their homes, and let the security organs just execute their mandates as they wait in their homes for the mandated body, that is IBC, to give out the results. So far, that's all we have from Mombasa County. All is well, is all systems go. And as I've told you earlier on, there's a meeting or security meeting or multi-sectoral meeting underway, and you're waiting. Just as they conclude, they'll brief us on the way forward as we head to this great day. That's all we have from Mombasa County. And back to you, Ben Troy.
Thank you, Mike. Thank you, Mike. Michael Mwadiga, live from Mombasa. And perhaps to just mention something that he has talked about is that security organs are meeting there to ensure that the coastal region is well fortified. Just 5 days to the general polls. Everything is set. IBC says we are set. Security forces say we are set. Is just the Kenyan that is left. And remember, you have an opportunity. IBC yesterday did talk about giving Kenyans an opportunity. There has been that big debate about the manual voter register. Well, it is there. It is already pinned in the schools that will be acting as the 46 in each of the 46, I beg your pardon, 46,229 polling stations. So you can go there beginning today, you can go there and make sure that your name and your details are in place so that when you get there on the 9th of August, then you will not have issues, but you just vote. And talking about elections, the 4 presidential candidates and also governors that have already talked about their agenda in the next government that is coming in after the August general polls. Talking about the health, they've promised a lot. And I can tell you something for free is that manifestos are just manifestos. They are promises. What we are even discussing here with these 2 professionals is even more practical than those manifestos. But question, they actualizable? Well, that is why we have Peter Wachira, who is the chairman of the Kenya Union of Clinical Officers, and Dr. Davji Atela, who is the Secretary General of KMPDU. And Wachira, before we crossed over to Mombasa, we were talking about the
brain drain.
Yes, and the 4% to 15%, how practical it is. Doc says, yes, it is practical, but workability, the implementation itself.
Yeah, I think for anybody who is promising us, if you want to move from coverage to care, care is expensive because you have to assure us of that quality. You have to employ specialists. You have to ensure you have enough staffing so that you can be able to take the others for specialization and improvement of skills so that then you can be able to move from that coverage to care. That must have investment commensurate to it. And so a promise of progressive 4 to 15% is actually in line. And I think that is tailored towards realization of the same. I've actually seen it on both sides. It's only that the other side it has not been enlisted as 4 to 15. But even on the side of Azimio, there is improvement of investment in health to be able to attain universal health care. And I think that is basically what you are saying. So the issue of brain drain, it's very unfortunate. Healthcare workers are a scarce resource across the globe. There are countries which have the money and they are willing because they want to cover their people. They want to have the right staffing. And that is why they poach, if I can use that word, from these countries that do not seem to prioritize and to see the importance of their healthcare workers. I've seen several clinical officers move to the US, some others to the Middle East. People of more than 10 years of experience. I've seen several nurses from Kenyatta National Hospital, some of whom we were even with them in response for Ebola, very well equipped. Some of them who are leading the efforts towards the fight for COVID-19. They have actually migrated to the UK and to the US. People I know of almost 20 years of experience.
Is it so unfortunate that when you hear about jobs outside, the healthcare workers, the doctors, the nurses, and all those who are working in the health sector, they are one of the best paid in the world. But unfortunately, the situation is not the same here in the country.
No, it's not the same. And you know, it even goes beyond pay. Even if you were to pay me so well, but then my working environment is so stressing that sometimes we'll have to contemplate suicide like we have seen, because these are cases that we have seen. Then I would look for somewhere where the working environment is better. But I don't know, and I don't know why the political class wants to push the narrative that healthcare workers, especially in Kenya, that are very well paid. I think comparatively, healthcare workers in Kenya earn a mega pay. And you know, healthcare setting, the environment we work under is very stressing and very demanding. We are not like the other professionals who will be able to do things on the sides. For healthcare workers, they need a lot of support, from monetary-wise in pay to even psychosocial support. Like one thing that we have realized, and I think if you look at the presidency, it has also realized something else. They have, I think, established a mental health facility for the army, and I think for the police.
Yes, they did.
But who has established one for medics? You know, medics are the ones who deal with all the other things, even those military personnel and discipline forces.
So what do you do as medics? Because the situation is a good thing that you have observed that we have healthcare facilities for Kenyans, for our soldiers, but we do not have one for our medics.
Yes. And I think that underpins the fact that we do not take care of our caretakers. And because we are not taken care of, and you're expected to take care of everybody else, then we do not debrief. We do not have sessions where we are also counseled, because also healthcare workers need a lot of counseling. And that is why we are really having substance abuse and addiction among healthcare workers. Because that environment they're working under is very stressful, but nobody has looked into how can we be able to improve. Because if you want to look at their mental health care, it doesn't only end, even if you are to create a very nice hospital for psychosocial support, but then the working environment down here is very stressful. Their pay is so meager such that they are not able to pay for their parent who is sick and to pay for their relative who is sick. They are not able to take their kids to a good school. They are not able to stay in a good house where they can be comfortable and they can be able to be coming to work when they have clarity of mind. Then you'll only push so many into that psychosocial facility. You'll not be addressing this. So it must be wholesome, and I think it's a conversation that we should be able to have. And that is why we came together. And it's good that I have my brother here, who we co-chair the Kenya Annual Health Workers Convention that is going to happen every year, and that we started last year, so that we can all come together as Kenyans, the unions, the government, the private sector, everybody who is concerned about health, and we can look at what are the challenges that affect the healthcare setting, the environment, and the 360 sphere, and then we can be able to provide solutions as Kenyans as to the best direction we should be able to take.
And indeed, that is where, Doc, you will pick it up, but unfortunately we have to first of all have a short quick break, but when we come back, more on how to take care of the caretakers. We'll be back in a short while.
To get Nicene Creed as your skiza tune, dial *811 *961#.
We believe in one God, the Father, the Almighty, maker of heaven and earth and all that is seen and unseen. We believe in one Lord, Jesus Christ, the only Son of God, eternally begotten of the Father, God from God, light from light, true God from true God, begotten, not made. One.
To get Nicene Creed, dial *811 *961#. *811 *961#.
The 2022 Commonwealth Games will be hosted in Birmingham, United Kingdom from the 28th of July through the 8th of August 2022. Team Kenya is set to make its 17th appearance at the Games. Kenya will contest for medals in several disciplines, among them athletics, boxing, hockey, rugby, weightlifting, wheelchair basketball and parasports, among others. Watch the Games live on KBC Channel 1. KBC Channel 1, your true sports partner.
Kwa miaka 11 Minto FM imekuwa pamoja nanyi ikiwapa burudani na kuwaelimisha. Na sasa tunawaalika mashabiki wetu tujumuike pamoja kwa tamasha la Minto Night. Tarehe 6 mwezi Agosti tutakuwa na Minto Night huko Winds Park Resort Kisii. Wanamuziki kama vile Kwasa Kwasa, Embarambamba na wengine watakuwa site kuwaburudisha. Siku ya Jumapili tarehe 7 Agosti, Minto FM itaandaa maombi ya shukrani na kuombea uchaguzi wa amani katika uwanja wa Itiero Primary School kuanzia saa 3 asubuhi. Waimbaji wa nyimbo za dini wakiwemo Evangelist Eric Mwaniki, Molly Kemunto na wengineo watakuwemo. Nyote mwalikwa.
Minto FM yenye karuga y'ubusi.
Welcome back, and this is KBC News Tech. Today we are looking at the health agenda, and especially 5 days to the general pause. And what I've been able to gather is that the medics or anybody who is working in the health center wants a better government, better terms, better working conditions. And that is why I have two professionals here. We have the chairman of KUKO, and also we have the secretary general of the KMPDU. And before the break, we were looking at who takes care of the caretakers. But before we continue with that debate, let's first of all cross over to the Best Western Plus Hotel in Westlands, where we are having an International Republican Institute in partnership with the Nairobi County Committee of Eminent Persons on Peaceful Alternative Dispute Resolution Mechanism, holding a forum on mitigating possible electoral violence in the country. Just 5 days. Let's first of all listen to what they have to say, then we get back to this live discussion.
If peace is in our hands, we must be able to protect, to prevent, to uphold peace at all times. My appeal to all of you is to ensure that when you're vying, when you're voting, when you're campaigning, you must ensure that you respect life, that life is very important. And not just life of an individual, but life of every Kenyan is very important. And more so, I put women in the forefront because they are the ones who bear the brunt. Peace is in our hands, and peace is what we must have by all means. Thank you.
Thank you very much. I'm David Gitunga, Senior Deputy County Commissioner and Personal Assistant to the Regional Commissioner, Nairobi Region. I'm studying in for the County Commissioner. One, I would want to say we've been holding consultative meetings with various teams, as you've seen today. Our key responsibility is to ensure that we provide security for people and their property. We've been able to hold various stakeholders meetings, set down strategies and procedures to ensure that we're able to provide and deliver a peaceful and secure general election. My appeal to Kenyans is that the security agents are ready to cooperate and work with you. We are ready to consult with you. We've put in place mechanism in which we can be able to get information from each and every part of the region And we would want people to feel free to report to the security agencies. Right from the sub-locational levels, the teams are ready and willing, and they are available to provide security and to consult and ensure that we are able to campaign, to vote, and even to receive the results of the voting. I would wish to appeal to you, ensure that you interrogate the manifestos of various politicians, vote wisely. We have Kenya as our country. We are not moving anywhere. We will be around. And also know that these people want to read us, and they cannot read a country which is at war. Finally, we have in place mechanism in which you can be able to access information from members of the community, the complaints, and I would request the media to publicize this number so that we can be able to get real-time information on the happening of all areas and to enable us to respond appropriately. We have 988. It is a Murika hub. You start with the message and you start with the county. We are in Nairobi. You start with Nairobi County. You go to the sub-county where you are. Then you indicate the place where you are. For instance, you're in Kibra. Then you report the happening. We'll get that message real time. Response will be real, and it is a free message. You will not be charged for anything. Thank you very much. Wish you all the best and hope that we'll have a peaceful general election. Thank you very much.
My name is Bilian Okoth Jiwa. I'm a UDA candidate for Mathare Member of Parliament seat. And today I'm here to represent a perceived hotspot that is Mathare. And for me, this is an important occasion because we are here to rewrite the history, rewrite the narrative that Mathare is a hotspot. In 2008, I was a young man, helpless young man, and a first-time voter, and I watched Mathare burn because of political differences. Today, I am a political candidate and a key player in this election, and I am here to commit as a candidate that will make sure that we maintain peace during and after the elections. So for me, it's just to represent Mathare and represent other candidates, and I hope that all of us can commit to making sure that our communities remain together during and after the elections. Thank you.
Yeah. And today we had also invited all the gubernatorial candidates, the Senate candidates, the women representatives, but then we've seen a no-show. We know all of them, all our politicians are good friends with the churches and the religious institutions and the media houses. We just want to
Those are just some of the stakeholders there at Westlands talking about election and more specifically avoidance of violence or pockets of violence that we have witnessed in previous elections there. And as you have seen, it's a stakeholders meeting incorporating agencies tasked with that mandate and also candidates to ensure that we have a free, fair, credible and peaceful election. We'll be getting back to that in our subsequent bulletin, but we continue with our live discussions. And Sports Fun, we have something for you, some minutes to 12, so just stick to your true sports partner, KBC. But let's go back to our topic of discussion. We're looking at matters health and in line with because next week, Wednesday, we might be having a new president who might effect some of the changes that we are talking about here in the health sector. Allow me to bring in Daktari. We have seen mass exodus of, Kenya has one of the best doctors and healthcare workers. And I know this because looking at Africa, in case of anything, we have doctors and healthcare workers going to help out. But unfortunately, how they are being treated here, we're talking about there are some strikes that are being planned because they haven't received their pay. But these doctors, healthcare workers, they are looking for greener pastures and leaving us exposed.
Yeah, I could answer that on two dimensions. Number one, I think the government has tried in a way to ensure that there is no much movement of workers from, let's say, Kenya to UK, especially that we have doctors who graduate in this country after 5 years, some after 7 years. And then once you graduate, it takes effort. You have to demonstrate and go on the streets to get compulsory internship that then equips you to go and get your licensing. Once you get your license, majority are currently not employed. So you remain unemployed, where you locum from one facility to the next. You move from facilities to get a meager salary or a meager wages for that. Mm-hmm. And then that becomes a problem because you are not having an employment. So for those individuals, I believe that if there's a chance that there's opportunities abroad and across the borders, it's very important that they move and get employed and get the work because it is injustice to them. And I know according to Article 97 of the ILO Convention speaks clearly of the skill migration, so that if you are skilled in this country and you go to UK or to US, you need to be paid as per that particular country's rates. Mm-hmm. So that is good for the individual, but for the country, it becomes a very devastating situation. I would always say it's full of frustration, and this is because we have the hospitals that are keeping on being built everywhere, but then when you don't have the healthcare workers, then they can't operate. Then the people can't get the services. But those also who are employed, we have seen anesthesiologists living in Nakuru, we have seen physicians living West Gishu, we have seen surgeons living like Kipia, we have seen doctors being dismissed and leaving the country. Mm-hmm. It is because once you're employed, you've done your undergraduate, you've done your master's over 7 years, and then you got employed in the county. But the county pays you in commensurate to a trainee doctor. Mm-hmm. And for you to be promoted to the next level, you have to go on strike. For you to get your salary. Like now we have doctors in Mombasa County, we have doctors in Meru County, we have doctors in Kisii, we have healthcare workers in Taita Taveta, we have those in Murang'a, who you do not know when your next pay will come. You can go for 2 months, 3 months. So that becomes a frustration among these healthcare workers. Mm-hmm. And one thing that is a fact is that healthcare workers know how to do their job and they love their job. So they do not get into other businesses like entrepreneurs or some kiosk or other businesses. They just know how to do their work. Mm-hmm. So when this pay does not come on time, then they get into that depression, they get into that frustration. Mm-hmm. And even that's why there's increased incidence of the mental cases in the counties because of that frustration. So under such circumstances, then a worker or a doctor will better move to a different country where their value is seen rather than in the country. Mm-hmm. And that has seen many of them leaving the country. Mm-hmm. As much as employment also has gone very low. So that's what is there now. And therefore we believe that when we are going to vote next week, we need to see how are we voting. Are we voting to change the status of healthcare in this country, or are we voting for a status quo? Where we're going to see no difference on what has been happening over the years and what we want to happen for the future.
Uh-huh. Yes. And let's shift focus to non-communicable diseases, because at the end of the day, all these politicians are promising us a lot, and especially in the aspect of non-communicable diseases like even cancer, we have like diabetes, where even if you have a cover, it has some limits in that cover. And talking about, we are going to ensure that because cancer has in the last couple of years, it has really taken a lot of people, and there has to be some investments or some tweaking of how things are working in the ministry in regards to non-communicable diseases.
Yeah, and I agree with you. And cancer has not only taken people, it has also impoverished more. If it takes one person it impoverishes probably 20 of them, because different families will have to contribute and sometimes
sell land,
even sell whatever they were using to get their money. And that is very unfortunate. It's supposed to be addressed by the universal health coverage, because we talk about protection from catastrophic medical bills. But how we can be able to get that right is not through the construction of the state-of-the-art facilities to treat cancer and non-communicable diseases. They are still important, because we'll have people who will be suffering from this. But the most important thing is a paradigm shift in our health system, where we now fund the promotive, preventive, as much as we fund the curative. And that is why I started by saying, as a country, we do not assure Kenyans of their health. We only assure them we are going to do our best when they fall ill. If we are going to assure them, let us have a paradigm shift. And it's good that we have seen the same being proposed on Azimio and also from Kenya Kwanza, that we need to establish and fund. But now the question is, when you are talking about funding and capacity building, the preventive and promotive, how do you propose on doing it? There are those who are proposing on taking the volunteers, a lay person, and probably capacity building them with a few skills and deploying them, and then you say you have employed healthcare workers and you add them to the numbers. That does not help anybody. We should be able to utilize the right professional for whatever they went to school for. If you look at the job descriptions of the public health officers, they're supposed to be in the community offering these preventive, promotive services. A clinic officer, at the lowest job group when you're entering service, one of your job description, you're supposed to do promotive, preventive, you are supposed to do community health interventions and family health interventions. You're actually supposed to sit with the community in the barazas and even to go around and even school health, be able to advise on what can be able to cause disease in future. How can you be able to avoid, can you be able to prevent this? And if we were utilizing our human resource in the right manner, we should actually have gotten right with this. And when you are growing up, I'm sure you remember these people used to come to your schools, you are given these dewormers and they would advise. Why isn't it happening now? Because our staffing levels never grew commensurate to the growth of the population, and so at some point healthcare workers became firefighters. We can no longer prevent. We are so few, so we'll only wait for those who can die, and then we take care of those when they fall sick. Then there is nobody to prevent disease down there. And so it's only by getting the right staffing and the right skill mix. Right skill mix means where you need a doctor, have a doctor. Where you need a clinic officer, have a clinic officer. Where you need a public health officer, have a public health officer. So that then, with the right staffing, everybody will be able to do their duty. You do not need to politically tell us that now you are going to employ 100,000 or 1 million community health workers who are actually do not have the capacity to be able to make that real change in the community, other than report to you what they have seen. And now they become a conduit of referral for the curative still, instead of having preventive down there on the ground. And so when it comes to now implementation of these manifestos, then what we need to see is that there needs to be a roundtable discussion with the expertise on what is supposed to happen, so that then we can get it right when you're having that paradigm shift, and now we can start assuring Kenyans of their health.
Indeed.
You wanted to
add something on his part, which really a bit more different with this school of thought on having the community health workers. I believe that when we want to change where we are right now, having the community health workers rather than community health volunteers is an empowerment scheme that will ensure that these point persons are put down into this grassroots level, understand what healthcare is, the hygiene aspect, they understand that this people need to be put to care. So that empowerment will actually enhance access. So that's why I believe that aspect of having community health workers really speak about health every time, sensationalizes and sensitizes the community on the need for health. And that will work well with the part that he brought in, that we need to have specialists, we need to have doctors, clinical officers and nurses down into the community, because one, this will help in the mega screenings that need to be done in order to identify different conditions or other cancers and other non-communicable conditions early enough, so that they can be managed in time, rather than when they're in stage 2, stage 3 or stage 4, when they're being taken to the referral hospitals. That will work much better for the community and for the country at large.
Okay, and Doc, before we cross over to the Commonwealth Games, I need to pick your mind on this. The 4 presidential candidates, as a union or as an individual, do you see any manifesto that maybe would just work to improve the working conditions of health workers in the country? And still, while you're at it, I was able to ask Wachira on the same. What lessons can we learn from COVID-19 in regards to our health sector?
I'll start with the last one. Is that what you learn from the COVID-19, that we need to invest in healthcare. We need to invest in the human resource for healthcare. We need to ensure that we have a working infrastructure, working hospital, and working health system. And that will ensure that in the eventuality of any pandemic or any outbreaks, we're able to control and able to manage, not to run around. But on the aspect of these candidates, I think the 2 primary candidates that are seen to probably will win these elections is either His Excellency Raila or His Excellency Ruto. But from the school of thought, I believe that the Deputy President has been the chairman of the Intergovernmental Committee for the last 10 years. And again, he is the same person who has been in the management of the county revenue with the county governors and with the council of governors. So it's then a bit the logic that what has he done to the healthcare amidst the industrial action that we've had from 2013 to 2022 that will be different when we elect him as the president? What mechanisms or mitigations has he put in place over the years? So that really makes me to have to question that what is he going to do different? But on the other side, we have His Excellency Raila and Martha. We have had situations of, I would say, of action as a union, where the governor of Laikipia and the governor of Kirinyaga actually dismissed doctors. And the person who came forefront to help us in having the mitigation was Her Excellency Martha Karua, where we had to take the governor to the Human Rights Commission, we had to take the governor of Laikipia to Ombudsman. Therefore, there's aspect of the social justice to the workers in those particular counties based on our reaction. And again, look at the plans that they have in Azimio regarding the healthcare workers, the plans to employ doctors, the plans to have universal health coverage, the plans for access. So we will say that there is a hope of change based on that. They've not been there for the last 10 years, and they have a plan to have things done. So I will subscribe to that line of thought as an individual, and I will advise that if we really need to have change, there's aspect of political neutrality. When you go for political neutrality, then you do not see change. Then you look for status quo. But when you want a change, you actually take a side and line with it.
All right. Final words. We have around 2 minutes. Just a minute each.
Yeah, I think my closing remarks would be, as I have been saying over the years, for every Kenyan, we must realize that there is no wealth without health. If that candidate, be it your MCA, your gubernatorial cabinet or candidate, or your presidential candidate, if they are not able to assure you of your health care, if you are not confident, there are people who can be able to deliver on that manifesto on healthcare. They are just politicking. Please avoid them. Please, when they come to you, first ask, what are you providing for healthcare to ensure that we get that universal healthcare? If they cannot be able to answer you that question, do not listen to them.
All right. Your closing remarks, 30 seconds, kindly.
That's when we go to election next week on Tuesday, let's vote for our freedom. Let's see those who have been with us in the struggle over the years and for the change that we need. Let's take sides. We are in blue, and we need to vote and ensure that we have a change in healthcare in this country and a change in how we handle the issues of healthcare, which will trickle down to everybody in ensuring that the services are seen and we have healthcare and healthcare workers as needed.
In 10 seconds, perhaps you can touch on that, the seminar that you're having, the second?
Yes, we have been having the annual convention of all healthcare workers in the country. I am the Secretary General of that particular caucus. And one thing that we look at, we do not want to have continuous industrial actions or other strikes in every part of the country. Yeah. And therefore, we've set up these conversations that brings up together all the unions, brings together the associations, brings together the government, that we sit together, converse, and look at the mitigation ways or frameworks that will ensure that in these issues that are affecting healthcare workers, that are affecting the health service provision, we come with a framework that will ensure that the service provision without necessarily going on strike.
All right.
And that will make sure that all these points that have been put in the manifestos are actually implemented.
All right.
Yeah.
Thank you. Thank you so much. When is it?
We will have it in the month of April.
All right.
Yeah.
All right, and perhaps you can touch on the same as well, because you are also a participant in the same, because it's all the health workers.
Yes.
Yeah. All right.
We actually co-chair persons with my brother here. And I think apart from that, I think there are very important resolutions that came out of that. One is that we should have annual employment of healthcare workers, that is learning from the lessons of COVID-19. And the other most important is that the incoming government should be able to form a task force to bring in the leadership of the healthcare workers and the unions, the Council of Governors, and the Ministry of Health together, so that we can look at how do we provide a solution for the ineffective management of the human resources for health.
All right. Thank you so much indeed. I've been speaking to two health practitioners, and also they are their respective heads of their unions. On my immediate left, we have Peter Wachira, who is the Kenya Union of Clinical Officers National Chairman. And also we have the National Secretary General of Kenya Medical Practitioners and Dentist Union, Davji Atela. Thank you so much, gentlemen, for coming, and thank you for your insight. Kenyans, then you've had it, then make a wise decisions. Just 5 days to the national election. My name is Njue. It has been a pleasure having you for News Check. Thank you so much for watching. We'll be crossing over to Birmingham in a few. But from me, thank you so much and have a wonderful afternoon. It's still morning. All right, some minutes. Thank you so much. Thank you, gentlemen.
The 2022 Commonwealth Games will be hosted in Birmingham, United Kingdom from the 28th of July through the 8th of August 2022. Team Kenya is set to make its 17th appearance at the Games. Kenya will contest for medals in several disciplines, among them athletics, boxing, hockey, rugby, weightlifting, wheelchair basketball and parasports, among others. Watch the Games live on KBC Channel 1. KBC Channel 1, your true sports partner.
But did I lose my babies?
Only one of them. That's why you felt sick and you woke up all bloated.
Don't ever do that, Adrian. Do you think I'm so helpless that I won't be able to earn a living for myself? No.
I don't even know how to approach you. I've forgotten you for many years.
And you?
We heard about what happened, son. We came to see you.
Get out. Get out of here.
Renea, please.
Go away.
Charles Sasati Munyoro, the late Robert Okwan Julius sang in the 1970 Commonwealth Games when they won the 4x400 meters relay.
Kila mwaka watu kamna different strategies za kukimbia. So time yenye walikuwa nakimbia kama walikuwa nakimbia 44, maybe hawakuwa wengi sana kama sahi. So sahi ukimbia 44 tu ni mtu wa kawaida. So ukitaka kuwa extraordinary lazima ukimbia 43. So I think yao ilikuwa challenging lakini si kama sahi. Hii unaweza pata kama tuseme World Championship ukiwa na 43 uko